Yeah, here.
Yeah, okay, yeah, okay. Maybe I think yeah, maybe next slide now. Yeah, this also yeah, next, yeah. Yeah, this one also I think we covered already. And okay, now some stats of teenage pregnancy in Bhutan. So 1 in 10 women at the age of 16, okay, it was in one of the study I found that 1 in 10 women at the age of 16 years and 3 in 10 at the age of less than 18 years. And this figure have even raised during COVID-19, during the time of pandemic. Like any other country, of course, in our country as well, the teenage pregnancy incidence was increased during the time of COVID-19 as well. Next. Why are this problem with going to next, Kile? Again, problem going to next slide. Okay. So to address to address this adolescent sexual health, of course, in Bhutan, we are fortunate enough to have our Queen Mother Ashika Sangye Children Wangshu, who is I think she's one of the long-lasting goodwill ambassador of UNFPA. So under her guidance, our whatever message that we are going to convey to adolescents has been going quite well, and also with the help of other organizations, as well as with input from both Ministry of Education as well as Ministry of Health, and with help of other NGOs like Renew, NCWC. So all are geared towards addressing the adolescent sexual and reproductive health. Next, please. So just a few timeline about the adolescent-friendly health services in Bhutan. So it was in 2013 that our first national strategy for adolescent health was implemented. And by 2014, almost adolescent-friendly health services were established in our tertiary hospital in capital, as well as 2 regional referral hospitals. And in the 2017, there was national standard and implementation guideline for provision of adolescent-friendly health services. And in between 2019 to 2013, a second strategic plan of action whereby 13 adolescent-friendly health services are designated in the district hospital, because in Bhutan, the health system, we have a 3-tier system actually: tertiary, then district, and then the basic units. And by this time, that all the health centers in Bhutan have at least one focal person designated for adolescents to provide and to advocate on to provide the adolescent-friendly health services in Bhutan. Yeah, next. Next, Kile.
Yeah, I'm sharing.
Yeah.
Can you see my screen?
Yeah, you can see. Just can
Hello?
you just click to next? Yeah, can you just click to next slide?
Okay. They cannot see. What's happening?
Yeah, we can see your slide.
Is it seen now? Can you see now?
Yeah, you can scroll down. Yeah.
Is it this one?
No, it's still in the cover page.
Can you see?
Yeah, but it's still in slide number 1.
Don't know what happened.
Anyway, only few slides.
Hmm. Is it visible now?
Yeah. Next. Yeah, next. Yeah, next. Okay. Yeah, please. One slide before. Yeah. Now, regarding the sexual education in Bhutan, just a brief a timeline. It was in the 2008 that the life skill education was implemented in Bhutan. And in 2000 and 2021, the National Strategic Framework on Comprehensive Sexuality Education was launched, and whereby the students, the comprehensive sexuality education was even incorporated into their curriculum as well. And even the Youth Peer Education Network, online courses are being also organized by the youth themselves. And in 2000 and last year, there's a program called Shift Bhutan program, whereby actually the adolescents themselves get involved and provide advocacy among themselves, helping each other. So basically, we are moving towards the theoretical into the more practical, whereby we involve the adolescents themselves in order to have a better practical reality. The health services in Bhutan. Yeah, next. Yeah, sorry, one. So the coming to the challenges, of course, there is a problem with accessibility. Firstly, it's a cultural norms whereby still the elderly people and even the culture, as a healthcare ourselves is not actually not very ready enough to make this health service very friendly for adolescents. And of course, although I have shown in the timeline that it has been for a quite long time that there was a sexual education curriculum in the school, but still then we would say that I can't say that it does not have any effect, but it was quite inadequate or inactive sexual education. And when it comes to the health services as well, there's some barriers as well because adolescents raise concern regarding the privacy and confidentiality. Although we have set up a separate adolescent friendly health provider and a clinic separately, but somehow we are not fully able to implement because of lack of human resource. The lack of time. Yeah, and even the provider ourselves are not very well equipped enough to deal with adolescents' needs because it is adolescents' need is something unique and it is quite unique compared to other normal general patients that we look after. So one factor is that one, and of course, still there are social barrier. As I said before, that still the parents, the teacher, and as a social elderly population, still there's among from their side there's still stigma and discrimination to the adolescents. Yeah, next. So when it comes to the accessibility barrier, so yeah, these are the responses given by the adolescents, female 17 years old adolescent. Yeah, have you said that talking openly about sex, sexuality, and relationship at home, so school is difficult, and going to health service is equally burdensome, as we may have to go through the reception or registration just to obtain some information, and this increases when health workers to share our sexual and reproductive health concerns because we don't feel comfortable opening up to them. So these were the concern raised by the adolescents. So even in the school, our teachers look uneasy. So these were some of the information that we get from the adolescents. Yeah, next. And coming to the healthcare provider, in one of the survey done by Ministry of Health in 2020, it was reported more than half actually 59% of health facility managers were actually not aware of the guidelines that support adolescent and youth in accessing their facility. And yeah, I want 60, more than 64% of the service providers revealed that they actually did not have capacity to deliver some sexual reproductive health services. So this was as per the survey done by Ministry of Health. So showing or indicating that we healthcare workers still need to have a way forward. Yeah, next. And coming to the social barriers, these are the response given by some of the parents. Okay, so we say that we fear, this was given by the participant adolescent. We fear of being judged by society, and most of us feel shy and embarrassed to talk about sexual and reproductive health, and it's not encouraged to discuss about it in our family and community. So, and on other hand, this was the response given by the parents. And parents said that we understand that the importance of sexual and reproductive health for our children, but still, I feel that by giving them more information on sexual and reproductive health may actually trigger them to involve in more sexual activity at the early age. So such type of responses really shows that there's still some social stigma and discrimination from the society as well. Yeah, next. So coming to the next, that is why adolescents are at increased risk of sexually transmitted infection. So adolescents is a particular group of population where there is high unmet need of contraceptive methods. So it could be because of high unmet need of contraceptive method contributing to sexually transmitted infections among adolescents. And unlike the married person, like all of us, they don't actually, adolescents don't have a fixed partner, so they can have a multiple partner, thereby increasing the risks of STI. And of course, at this vulnerable age, they are more prone to have get influence of peer pressure into substance abuse, leading subsequently to the unprotected sexual intercourse and causing them to have sexual transmitted infection. Yeah, next one. So our way forward now, although we have comprehensive sexual education in school, depending on when we just listen to the adolescents, hear from the adolescent, we still need to strengthen this comprehensive sexuality education in the school. And we strive to make adolescent-friendly health service both provider and user-friendly. The provider should be also comfortable, confident enough to provide services, and it should be made user-friendly. It should be more friendly towards adolescents. And as we have already started, we should continue to engage youths in advocacy. It's not about teaching them or counseling the youths. It would be rather make a big effect if we actually engage the youth themselves in advocacy, and like what they have already actually started, like online courses, organizing the workshops involving the youths would be a way forward. These are some of the things that we can do further. And there are lots as well. Yeah, I think that's the end of the presentation. So of course, this presentation was not very smooth. Sorry for that, because of some technical glitch, which something that Zoom, we really talk of it as a very good way of communication, but sometimes this technical glitches, of course, is one of our disadvantage about this technology. So that's it from my side. And if you have any questions, we can discuss together.
Thank you so much, Dr. Pupa, for your comprehensive presentation. And yes, I would like to apologize all the participants. We did have quite a number of participants in the beginning, but I'm very, very grateful for all the participants who remained, rejoined, and gave your valuable time to us. In fact, this is a very enriching presentation. Dr. Pupa, thank you so much for us, GP, and I'm sure that I'm hoping that I will be able to make everything, all arrangements more smooth during the next presentation, and I hope that whatever hard work and your expertise can be used wisely next time. Thank you so much, Dr. Pupa. We'll open the floor for questions if there is any. And I also like to thank Dr. Hina, Dr. Vikram, and Dr. Sarita for your valuable time. Yes, we have a question in the chat box from Dr. Sarita Nima. What can be the impact of sex texting on the new generation? Dr. Pupa, would you like to take that?
So what can be the impact of sexting and the new generation? Yeah. It's just my opinion, okay? Because by advocating on this adolescent sexual and reproductive health, it does not mean that we are restricting sexual activity, nor we are favoring sexual activity. The sex is something of our individual right. But what we as a health worker or as a society aim is to make them more informed, let them be able to confidently take care of themselves rather than if they really want to it's of course obviously that they don't want to undergo teenage pregnancy or something that they can control over what they are doing, then I think that by giving advocacy, teaching the adolescent and this so information is actually to help them become more confident about about their body, and it's not something that we actually discourage sex or favor sex. So sex, after all, is their own choice. But given the fact, but we need to make sure that they are doing it with their own self confidence, and not something that of out of lack of information and all. Yeah. And if you have any more, Kile, you can also add.
Maybe we can ask our senior doctor here, Dr. Hina's opinion on the impact of sex texting on the new generation as a senior GP and also the academician and expert. And would you like to take this question?
Hi, can I just say something?
Yes, please, ma'am. The floor is yours. Thank you.
Hi, thank you for arranging an amazing session. Despite the technical glitches, I think you were able to take it to completion, which is very good. So hats off to your patience and perseverance. It was a pleasure listening to Dr. Kruba. I'm sorry if I'm not pronouncing the name correctly. I do apologize for that.
Yeah.
But I think it was very insightful. And it was a general practice, primary care focused. And I think that's what we mainly try to do through this educational activity that we try to offer through a family physicians forum. So thank you for keeping it very simplistic. Thank you for keeping it community oriented. And we would love to have you again on another similar session if you have the time. Thank you very much.
Thank you.
Thank you, Dr. Hina, for your wise words. Thank you, Dr. Pupa, for sparing your valuable time with us and imparting this very enriching knowledge to us GP all. We hope to see you again, and thank you so much for also being very patient with all the technical glitches we had today. Thank you all.
Okay, thank you for
Thank
opportunity.
you. Bye. Bye.
Bye bye. Bye bye.